Good day, everyone. Today, I want to talk about something that many people are familiar with, something we see almost everywhere, yet often underestimate: smoking. For some, smoking begins as curiosity. For others, it starts as a way to fit in, deal with stress, or feel more grown up. At first, it may seem harmless, just one cigarette, then another. But over time, smoking becomes a habit, and then an addiction. What many people don't realize is that while smoking may feel like a personal choice, its effects are deeply personal to the body, and often permanently damaging. Cigarettes contain more than 7,000 chemicals, many of which are toxic. At least 70 of these chemicals are known to cause cancer. Once inhaled, these substances do not stay in one place. They travel through the bloodstream and reach almost every organ in the body. That is why smoking does not only damage the lungs, it affects nearly everything that keeps us alive and healthy. Today, I will walk you through 10 major ways smoking damages the human body, explaining not just what it does, but how it slowly changes the body over time. 1. Let's begin with the lungs, because this is where smoking causes its most direct and visible harm. Every time a person inhales cigarette smoke, it enters the lungs and damages tiny air sacs called alveoli. These air sacs are responsible for exchanging oxygen and carbon dioxide. Smoking weakens and destroys them, making it harder for the body to get the oxygen it needs. Over time, many smokers develop chronic obstructive pulmonary disease, also known as COPD. This includes conditions like chronic bronchitis and emphysema. People with these conditions often experience constant coughing, shortness of breath, chest tightness, and fatigue. Simple activities, like walking upstairs, or even talking for long periods, can feel exhausting. What makes lung damage especially dangerous is that much of it is irreversible. Even after quitting, the lungs may never fully return to normal. This shows how serious smoking's impact on breathing truly is. 2. Now, let's move from the lungs to the heart and blood vessels. Smoking is one of the biggest risk factors for heart disease. The chemicals in cigarette smoke damage the lining of blood vessels, making them narrower and less flexible. Smoking also increases blood pressure and causes the blood to become thicker, which raises the risk of clots. Because of this, smokers are far more likely to suffer from heart attacks and strokes. In fact, smoking doesn't just affect older people. Even young smokers can develop heart problems much earlier in life than expected. The heart works non-stop to keep us alive. When smoking interferes with this system, the consequences can be sudden, severe, and sometimes fatal. 3. One of the most well-known dangers of smoking is cancer. Smoking is the leading cause of preventable cancer worldwide. While lung cancer is the most common, smoking also causes cancers of the mouth, throat, esophagus, pancreas, liver, bladder, kidneys, and cervix. Cigarette smoke damages the DNA inside cells. When this damage builds up over time, cells begin to grow uncontrollably, forming tumors. Many smoking-related cancers are aggressive and often diagnosed at later stages, making treatment more difficult. This is why smoking-related cancer remains one of the leading causes of death globally. 4. Let's talk about the brain and mental health. Nicotine, the addictive substance in cigarettes, acts quickly on the brain. It creates a temporary feeling of relaxation or pleasure, which is why many smokers feel calmer after smoking. However, this effect is short-lived. As nicotine leaves the body, it creates cravings, irritability, and anxiety, pushing the smoker to light another cigarette. This cycle leads to addiction. Smoking also reduces oxygen supply to the brain and increases the risk of stroke. Over time, it can affect memory, concentration, and decision-making. Research has also shown links between smoking and increased rates of anxiety, depression, and cognitive decline later in life. 5. Let's move on to the immune system. The immune system protects us from infections and helps the body heal. Smoking weakens this system significantly. Smokers tend to get sick more often and take longer to recover from illnesses. Common infections, such as colds, flu, pneumonia, and tuberculosis, are more severe in smokers. Wounds also heal more slowly because smoking reduces blood flow and oxygen delivery to tissues. A weakened immune system means the body is constantly fighting an uphill battle. 6. Now, consider the effects of smoking on the mouth, teeth, and gums. Smoking causes stained teeth, bad breath, and gum disease. It reduces blood flow to the gums, making infections more likely and healing more difficult. Over time, this can lead to tooth loss. Smoking is also a major cause of oral cancer, which can affect the tongue, lips, and throat. These cancers can change a person's ability to speak, eat, and even recognize themselves in the mirror. 7. Another visible effect of smoking appears on the skin. Smoking speeds up aging. It breaks down collagen and elastin, the proteins that keep skin firm and elastic. As a result, smokers often develop wrinkles earlier and have dull, dry-looking skin. Cuts and wounds also heal more slowly, increasing the risk of scarring and infection. Many long-term smokers look significantly older than non-smokers of the same age, a condition often called smoker's face. 8. Let's now talk about the digestive system. Smoking increases the risk of acid reflux, stomach ulcers, and inflammatory bowel diseases, such as Crohn's disease. It also affects the liver and interferes with how the body absorbs nutrients. This means smokers may suffer from vitamin and mineral deficiencies, which affect energy levels, bone strength, and overall health. 9. Smoking also has serious effects on reproductive and sexual health. In men, smoking reduces sperm count and quality and increases the risk of erectile dysfunction. In women, smoking can cause fertility problems and complications during pregnancy. Babies born to mothers who smoke are more likely to be born prematurely, have low birth weight, and develop breathing problems. These effects can last a lifetime. Finally, 10. Let's look at bones and muscles. Smoking reduces bone density, making bones weaker and more likely to fracture. Smokers have a higher risk of osteoporosis and take longer to heal after injuries or surgeries. This can affect mobility, independence, and quality of life, especially in older age. In conclusion, smoking is not just a habit. It is a powerful and destructive force that damages nearly every system in the human body. It affects how we breathe, how our heart functions, how we think, how we heal, how we look, and even how long we live. The good news is this: the body begins to heal the moment smoking stops. Heart rate improves within minutes, lung function improves within weeks, and the risk of serious diseases decreases over time. Quitting smoking is not easy, but it is possible, and it is one of the most important decisions a person can make for their health and future. Let us choose knowledge over ignorance, health over habit, and life over addiction. Thank you for listening.